My Doctor Said What is a program for health information. Be careful that if you want treatment and diagnosis of disease, you need to go to your local healthcare provider. Hi, this is Dr. Frank with My Doctor Says What? In January of 2024, our 35th episode after a couple weeks being off for the holidays. I wish you all had a great new year, and for a healthier 2024, we'll go through our health and wellness tips. My life as a pathologist and toxicologist has been all about finding the causes of disease and preventing those diseases. So what we learn from tests and autopsies and all those good things help us learn more about diseases and help you stay healthier. So you can see Dr. Frank, My Doctor Said What? My 15-minute YouTube broadcast every Tuesday, and it's on all major platforms as a podcast. If you don't want to see the video, just listen to the podcast. So with that, a couple health tips, general health tips for the new year that I think are really important. Blood pressure. Everybody needs to watch their blood pressure. Go to Amazon or Walmart or wherever you want and get you one of these blood pressure cuffs. I like the nice automatic ones, and ask you to take those. Real simple, the instructions with them. You take your blood pressure several times a day. Those, even a cheap one, will have a memory and show if it varies during the day. Don't take it right after exercise, and a few other things they'll tell you. Always have your arm elevated a little above your heart and relaxed, leaning on something. And that is very important, because if you have blood pressure issues or widely varying blood pressure, which can be a sign of medication effects or other internal effects, then you need to see your healthcare provider. Remember, we're giving health and wellness and prevention tips. If you need treatment and diagnosis, you need to go to your local healthcare provider, your doctor, physician, nurse practitioner, or PA. So with that, second tip. These, I got to tell you, little plackers. Let's see where you can see that real well. I can't floss my teeth with regular floss, difference in variation of teeth, a lot of things, but those are great. And you can have one around, have a bunch at your office, and flossing your teeth removes plaque, build-up of bacteria, tartar, and it helps you prevent buildup of plaque in your arteries. It's good for your heart health. A super simple, inexpensive, very minimal time-consuming tip that'll make a huge difference. Very thankful last year. Probably one of the things, the highlight of my podcast has been, had many people have told me that on radon, having their houses, if they have a basement or crawl space, tested for radon, or buying the test monitor at their local retailer, Amazon, Walmart, wherever, has been a godsend. They found they were way above, and where I live here in southern Ohio, central Kentucky is full of radon. When I lived in New York, same way. A lot of places I've lived, Michigan was the same way. I've had to have every one of my houses remediated except the one I live in currently. And it was well worth $1,000 or $1,500 to put the vent in, have it put in, and remediate, just pulling that gas out so that I'm not getting radon exposure above a safe limit, which is a leading cause of lung cancer. It can be like smoking 3 packs of cigarettes a day for those that don't smoke, and you don't even know you're exposed to it. You can't smell it, can't see it, can't taste it, can't feel it, but those gamma radiation particles are going through your body and just destroying and mutating cells. So whatever you do, have your house tested for radon this year. Do it yourself. Spread it among your neighbors. Let everybody borrow. I think that last radon detector I bought was $100. Gives you a good idea. Then a remediation company, if you have issues, can come out and take better tests and remediate it very simply and fairly cheaply. If you live in an apartment, you could test, and your landlord needs to do something about it if there's an issue. Gluten. Well, everybody wants to be gluten-free, and you know it's mostly wheat, but there's other grains that are involved in gluten. Be careful of this. Know what you're eating if you're eating gluten-free products. because a lot of times gluten's a binder, and if you exchange it for other binders so it's gluten free, for example, a cauliflower crusted pizza, many times those are much, much higher in bad fats than the gluten version. So you're trading one thing for another. If you just want to be gluten free for trends, just realize that a lot of times you're going to be eating a diet that's much more unhealthy for you. Now, if you got celiac disease or a real allergy to gluten or whatever, then you need to look at healthy alternatives. So, with that, I'd like to say that monthly or weekly breast exams for you women, especially those that are going through menopause. And menopause has, as I've spoken many times before, the drop in estrogen and progesterone can really be traumatic in a lot of ways, mentally, physically, emotionally. One of the things you really got to watch is breast cancer. So be careful. Look at your lymph nodes, feel for lumps, bumps, irregularities, as well as the breasts. If you don't know how to do a breast exam, there's a million references you can get online. Not literally a million, but there's a lot. And reputable medical websites. And I'm sure your partner would be happy to do it for you if you don't want to do it, but you need to be familiar, get familiar with your breast tissue, and make sure you feel for any lumps as they're small and you've got a chance of early detection. If you get your mammogram, and I hope you get it yearly, you definitely want to get, if you have dense breast tissue, and your healthcare provider will tell you that, your OBGYN, then you need to get a little different 3D mammogram that is better suited to determining if you have irregularities in that breast tissue. Very important. Early detection, very, very important. And with that, I am rarely an advocate of a lot of excess medication or hormone therapy for men. Definitely not testosterone unless there's really strongly advised for some unusual reasons by your healthcare provider. But for women in perimenopause or menopause between 40 and early 50s, given the many issues, like I said, psychological, physical, mental, the thermoregulation problems, the night sweats, the tingling, the in your extremities, the neuropathy, the pain in your pelvic region, a lot of things that come along with that, the mood swings, the anxiety, GERDs of all things, acid reflux can get much worse. All those things, I am for talking to your healthcare provider and see if they're for hormone therapy, replacement therapy. Because nowadays with the transdermal patches of estradiol, estrogen, and the combination of, if you have an intact uterus, of progesterone orally on a weekly and daily basis can have very minimal side effects. Used to be there were real concerns about excess cancer risk, but they've perfected that drug delivery to such an extent that it's worth taking a look at. If your healthcare provider thinks you're a good candidate, you should definitely talk to them. It can relieve a lot of suffering. And people think menopause is an event, but it's really between perimenopause, premenopause, and menopause can be a decade of your life. So you probably want that decade to have a much better quality and still not incur extra health effects. Speaking about GERDs or acid reflux, that burning feeling in your chest, and make sure you don't have cardiac issues. But if it's true GERDs where you lay down too soon, you scrunch up, you have excess weight in your middle, all those things contribute to GERDs. It pushes up pressure on the stomach contents, puts that acid content of digestion from your stomach up through the sphincter between that and your esophagus, and then the esophageal tissue gets that burning from the acid. Those tissues are not made in the esophagus to be drenched with that high acid content liquid. So you need to definitely have that taken care of. And things like Pepcid or Nexium or the different protein pump inhibitors are meant to be taken short term. You need to solve the problem. I had to lose 15 pounds. I used to have GERDs quite often, and I lost 15 pounds, and I haven't had GERDs now for almost 20 years. So it was just a matter of losing that 15 pounds for a lifetime of comfort and lack of those side effects of the medication. So with that, I want to finish up with joint problems, pain. At this time of year, start snow shoveling, doing a lot of things, going on vacation, going to sunny Florida or California or Arizona or Hawaii or the Bahamas, and you overdo swimming or whatever. Let me tell you, or do something rowing or paddleboarding. Shoulders, knees, hips, and back, usually the problem. And I can tell you right now, I'm a big advocate of a good diet. DASH or Mediterranean is combined with regular exercise that involves weight resistance for bone health to keep you from getting osteoporosis and strengthening your bones in general, increasing your metabolism. Believe it or not, weight training has good cardio benefits too. But then also, you want to make sure that in addition to that you're doing some kind of stretching, Pilates, yoga, or just stretching exercises. You can find some great ones online. There's a lot of good physical therapists that are online. And if you really get issues with pain, and that Aleve or a NSAID or ibuprofen or Tylenol or whatever does not help relieve, and you can't stay on those for a long period of time, again, side effects. But for the occasional flare-ups, heat, ice, all those things, the RICE method, and stretching, if that doesn't help, then see your healthcare provider, see a PT, a physical therapist, and it can make a huge difference. But for the long haul, so you're not crippled up and stiff and got especially low back pains that can really cause issues, lead to surgery, hip flexor pain being really tight, which I've got to work with because I cycle a lot, knee pain, or shoulder pain, you've really got to be careful. So physical therapy or stretching exercises before that, and some kind of Pilates, yoga can really make a huge difference. Those little synovial sacs, which are like little gel-filled sacs in between your joints that allow you to rotate so you don't have bone on bone as you get older. Sometimes those become depleted or torn, and you lose that synovial fluid, and then that has to be addressed by your healthcare provider. But short of that, and with a good diet and not having overt injury, you can avoid a lot of those issues. It can just be tendon and ligament strain, where the attachments have so much pressure with the leverage of your knees and your shoulders, your elbows, your hips, and your back, that you need to try to avoid that. That's why you always warm up before any kind of tough physical exercise, get the blood flowing, circulation good, and then go ahead and do those exercises. With that, I hope you have a great 2024. Hopefully we solved our audio video sync problems. And this is episode 35, General Health Tips and Joint Pain. I ask you to look at Dr. Frank, My Doctor Said What, on all major platforms. Have a great day. Remember, send your comments and questions to Dr. Frank at mdswpod@gmail.com.